Hey, everybody. My name is Alex from the IGAN Foundation of America. And so every Friday during Donate Life Month, I'll be interviewing a living kidney donor, and they'll be sharing their experiences through their process. So today, I'll be speaking with Dr. Michael Warner, a living kidney donor from California. Hey, Dr. Warner, thank you so much for giving me a few minutes of your time today to share your story with me. So the floor is yours right now to just kind of give me a little bit of insight as to how you started your kidney donor process, and we'll go from there. Nice to meet you.
Thanks, Alex.
Yeah.
Yeah, I mean, thanks for having me on. IGAN is a great organization, great way to bring everyone together and increase awareness. And that's pretty much what this discussion is going to be all about. You know, I practice as a family doctor for over a couple decades, and I'm now teaching as a professor at a med school in California. We'd all learned about transplants, and based on your training, you have some interaction. Certainly, as a family doctor, we had 2 or 3 patients that were actually kidney transplant patients that we took care of. Certainly, before our kidney transplant and after our kidney transplant, our interaction with our kidney transplant patients changed. Because our awareness changed and our understanding of the process changed. That's for sure. For us, it all started when our son was 9. Like some of you on the watching this, you may have started with a Henlock-Schlone purpura rash. That petechial-like rash on your buttocks and lower leg area, and dark urine. And that's what happened with our son when he was 9, and that quickly led to a biopsy and crescent cell formation, and forecast of imminent demise of his kidneys over time. And so that was at age 9, and then at age 18, when he was a senior in high school, is finally when we did the transplant process. So, what did you know? It's interesting. Like a lot of these things, you think you know a lot, and then once you're really in it, then certainly what you need to know rises to a higher level.
Mm-hmm.
And we got there. Mm-hmm.
Okay.
So yeah, that was my experience there.
So So when you started that transplant, you said your son was 18 when he started the process to get a transplant. Is that correct? You got the transplant. Like, how did that process kind of start? Tell me a little bit more about that.
Well, when if you're having a relationship with your medical providers with a condition like this, there's probably a good chance that you're going to have a relationship that's going to extend for years.
Mm-hmm.
And whether kidney demise would lead to dialysis, or whether it would lead to transplant, sadly enough, that's on the radar.
Mm-hmm.
For these conditions.
Sure.
Some people are very blessed in that they go right through and it never gets to that level, which is just fantastic. But of course, there are some of us that we go all the way down that process. So I remember it was in the fall time, getting into winter, that we started engaging, and some of it was very typical, like blood tests and all, to see who matches and who,
sure.
to see who's matching. And then after that process goes through, because I found out that I matched, so kept forward with the process for my son. And it was very levels. It was medical, like understanding what the process is about when you're engaging with the transplant team.
Mm-hmm.
And it's also psychological.
Very much.
In the sense of what it's going to take to go through the process.
Mm-hmm. The surgery and that. Sure.
Yeah. So, pretty much I think things started really heating up around January, and then April was the time. So, for someone who says, "Oh, we need it right now," it's probably I would imagine even today, it's still a multi-month process of making it all happen. Of course, there's going to be emergency situations, but it's probably still going to take months. And that comes to the patience of everyone involved, probably especially with myself as being a parent, from a
Yeah,
parent
yeah.
point of view,
That's where
because
I come from. Yeah, exactly. Outside of
yeah,
being a doctor, I mean, thinking about from a parental, emotional family, side of you. Yeah,
yeah, there's lots of times where things can't happen fast
of
enough,
course. Yeah, not, yeah, it couldn't
and
happen
you're
yesterday.
feeling that way. But it's a process that's pretty well laid down.
Sure.
Yeah. Mhm.
Okay. Okay. Good. Obvious question about second thoughts on the donating on donating. It did. I would assume in your situation, you were like once you matched, you knew you were going to do it. It's happening. I've had stories where I've talked to folks who are like, after doing this, they've had their regrets or whatever. So I asked it to everybody. Any second thoughts on donating a kidney? I think I know your answer, but I'd
That's
like
no.
to, have to ask.
Yeah. I wish I was born with 4 kidneys.
There we go. Give them more. Yeah, yeah,
Yeah,
yeah, yeah.
and
Yeah.
then there'd be plenty to
Of course, of
work
course.
with.
Yeah,
Yeah,
definitely,
yeah,
definitely.
yeah.
So
But that's understandable.
yeah,
I mean, I think it's worth
it's worth the dialogue. It would.
acknowledging people's thoughts about that, potentially
Mhm.
their fears. But
I think it's good to get it
you
out
know, I,
there.
I would I would imagine for most people,
It's
especially
yeah,
if it's a parent and it's your son,
of course, of course, of course. Yeah,
yeah,
most definitely, most definitely.
pretty
Um,
universal rule of humanity, right?
yeah,
Or
yeah,
living
yeah.
on planet Earth, right? Yeah.
Exactly, exactly, yeah. So along those lines as well, I mean, some folks, kind of leading into that, did you have any, financial issues after donating your kidney? Was there anything that you felt, I've heard stories of people who, after getting a kidney, had to file bankruptcy because they were considered to have a pre-existing condition once they altruistically gave a gift of a gift of life. So I asked that question to everybody as well. I'm curious to know if you've sensed that or seen that, or um, in doing your donation. Did you have any kind of financial hiccups or anything like that you dealt with?
Well, let me pause this for 1 second. Let me just yell out to my dog.
Sure.
A little dog picture up there. She's out to protect us. So
Oh, it's adorable.
I guess
All
in,
right.
I guess I guess in our COVID quarantine,
Right.
probably somebody in a little dog walked down the
They're
street and
crazy. Exactly. Exactly.
gotta do the shout out.
Mm-hmm.
Um, for us and for a lot of people, it's probably worth realizing that if you do fall into renal failure, that you do qualify for Medicare.
Correct. Correct.
Most people think of Medicare as old people, senior
Mm-hmm.
citizens,
Yeah.
particularly 65 and over.
Sure.
But Medicare also covers people that are disabled, whether it's permanent or temporary.
Mm-hmm.
So um, I even so for us, unfortunately, that wasn't part of the process that was part of our training.
Sure.
And we had our Blue Cross Blue Shield paid for by our private practice,
Mm-hmm.
medical practice that we had, and we went in, did the transplant, and that was in April. And then in June, July, when we got our renewal,
Mm-hmm.
we found out that our health insurance rose to over $49,000 a year.
Goodness gracious.
So that pretty much ended our private practice. So
Sure.
so 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 it
Yeah.
financially stopped the business.
Mm-hmm.
Um, that's some of the discussion that's probably worth people looking out for is
Definitely.
how is this going to impact me.
Yeah.
And I think it's probably a best practice um, to advocate for people that when their kidneys fail, go on Medicare,
Mm-hmm. Mm-hmm.
so that you're not put in the risk share
Of course.
of whatever you're in for your private insurance,
Right.
and potentially you know uh, destroy your ability to maintain whatever you have going on. I mean,
Exactly.
even with this whole COVID process now, there's a lot of attention that the country is not economically run just by a few companies. It's run by a lot of small businesses, and when you add up all these small businesses,
Mm-hmm.
you have a major economy. So
Yeah.
it's a medic. Once you get into renal failure, go on Medicare. That makes it very clear.
Yeah.
And then after transplant, you're on Medicare for 3 years
3 years.
afterwards.
Correct. Right.
Which,
Yeah.
if I had a magic wand, uh, I think as a society we're doing ourselves an incredible disservice closing that window after 3 years, because basically what you're doing is you're telling a population of people, hey, we need you to keep getting blood tests, we need you to keep going to getting medical services,
Hmm.
um, and if you fail and go on dialysis or need another transplant, we'll pick you back up.
Right. Yeah.
But if there's a problem in between, we'll just let you go.
I
That
don't.
that's called poor management.
Just a little bit.
From,
I know.
from,
Yeah. Yeah.
from
I
a
know.
society point of
I
view, that's
know.
poor management. I mean, that's the recipe for for disaster.
Hmm.
And I think that we really have to get beyond anticipating problems after they already happen.
Yeah. We got to be
You
preemptive.
know,
Hmm.
for us to think that, oh my goodness, people in the past were stupid and we're so smart.
Yeah.
Well, I mean, look at those COVID curves. The one
Yeah.
that goes up and the one that goes across.
Yeah.
Well, that's not something that people made up. I mean,
No.
that peak was actually Philadelphia, and the
Yeah.
slow was St. Louis back in
Right.
1918.
Exactly.
I
Yeah.
mean, believe it or not, people 100 years ago knew how to do math. Arguably, they didn't. They could do math better because they didn't need a calculator or Siri to do it.
Right.
They could do it in their head.
Yeah.
Even I
Yeah.
can
Yeah.
remember back when, in school, before we were allowed to have calculators
Yeah.
and lots of
Right.
stuff. Man, you could do things in your head really well.
Mhm.
You
Our,
know,
our bo- our society's gotten almost sort of like lazy to the calculator or Google. I mean, I feel like it's like
Well, I mean, which is fine. I mean, if you have
yeah,
a car, hop in the car and go somewhere. You don't have to ride
exactly.
a horse. You don't have to walk. That's
Right,
fine. I
right,
mean,
right, right.
leverage technology for what it's for.
Yeah,
But it doesn't discount the integrity of what was done. What was done in the past. And I think moving forward,
yeah.
as we become more cost conscious of healthcare, like
Hmm.
COVID is showing, and say,
Right.
what could we do to help people? Well, when we have these gaps,
Hmm.
such as 3 years after, and then they drop off,
Hmm.
if everyone, if everyone has the economic means to support themselves, that's fine. But lots of times you're talking about someone who's might get a kidney transplant when they're a child,
Right.
or they might get it when they're 25 years old
Hmm.
or
Yeah.
18 years old. So 3 years after that, suddenly you're 24 years old or something, and it's
Yeah.
like, well, now you're on your own.
Exactly. Yeah.
And is that really the burden we want to put on somebody with a chronic disease,
Hmm.
with an organ in their body from somebody else that we're trying to make work?
Right.
Then as a society, we're like,
Three
well,
years.
you
Yeah.
are on your own,
Hmm.
but if you fail, you can come back to us.
I know. Yeah.
It's almost like, saying, hey, after you drown, we'll pull you out of the water, we'll resuscitate you and bring you back to life, but then after 3 years, we'll just throw you back in the water.
Good analogy. Yeah.
So it's policy silliness, and I think a
Hmm.
lot of it's because of the non-awareness.
Start
You
early. I
know,
mean, preventative. I mean, if you can start with the G, and I don't know. I mean, you can speak to this as a general practitioner. I would love to hear your insight. This is kind of going off script a little bit, but like, when you go to medical school, like in regard to kidney disease, how early are you talking to patients? Like when you have to then specialize, send them off to a referral to a nephrologist before, like, is there ways to early detect kidney disease so that we don't even have to get to dialysis, like before you even have to get to that nephrologist stage, like to get to the early stages? I feel like I've seen in my experience and talking to general practitioners is that they once the GFR gets to a certain level, or once your kidney function gets to a certain level, then they're going to refer. But like in a physical, I don't remember as a kid, 18, 17 years old, having like a panel done where it looked at my kidney function. Maybe they did and I didn't, and it was fine and they didn't tell me, but I would have liked to have known, hey, like you might, these numbers are starting to creep up annually. And I just feel like that's something that if you could start early, that could maybe change some things. Can you speak to that a little bit as a professional?
sure. Well, other countries like Japan seem
Sure.
to be more aggressive on doing testing. Um, you could argue over whether taking a 5-year-old child and trying to get blood out of their arm, and
Sure.
the trauma of doing it to every single person, makes sense.
Okay.
And there could be some debate there.
Mhm.
Certainly to pull blood out of you and I, pretty
Yeah.
easy, and because
Right. Yeah.
we got pretty big veins being an adult,
Mhm.
no problem there. But when you're talking about a child or something, but then you start getting into urine testing,
Mhm.
and you know w-
Yeah.
what big cost is it to have somebody pee in a cup and
Exactly.
to dip it and to see whether you see any blood in there?
Right.
Because what happens is that an adult that goes through renal failure, or even renal demise, first of all, kidney function, like function of our lungs and everything else,
Yeah.
tends to deteriorate over time as we get older.
It's natural.
I
Right.
mean, if you had a body that ran perfectly fine, it would still show a decline over time as you
Get
you
older.
know
Of
got
course.
closer to 100 and got beyond there. I mean,
Yeah.
numbers are gonna decline off. We've
Mhm.
seen that with smoking, for example, that your lungs will last you the lifetime, but if you smoke, then that decline is like twice as fast, which
Right.
which is why you might have people that are 60 years old and are having huffing and puffing and they're having trouble, and that's because literally they kind of ruined a lot of their lung function because
Exactly.
of the heavy smoking, or maybe
Right.
something in the work environment plus that.
Sure.
But um but the thing you're looking for is that, yeah, if you're an adult, there's a good chance you're going to get some kind of blood screening done to look at your
Right.
cholesterol, look at your thyroid,
Yeah. Right.
whatever else, and in that packet is going to be renal function. The
Mhm.
trick, though, particularly with IgA,
Mm.
is that
Like dormant.
it
Yeah.
can be a problem of adults, but sadly it's a problem that can hit kids. And sometimes when you find it, you're finding it at a point where there's an expression of a rash or
Mhm.
dark urine or some other problem with the person that is so huge that's prompting the providers to then do a blood test, and then they're finding it.
Right.
um,
Right.
so then you're off to biopsy. So
Right.
that's really tricky, and that's where IGAN
Mhm.
is really good about promoting
Right.
different kind of tests that can be
Yeah.
done.
Yeah.
And you can see the race right now for COVID, and to come up with appropriate tests, not only for positive or negative, but to see
Mhm.
that if you have antibodies and whether you're immune and all that
Yep.
stuff. And that's going to come to market very quickly because the need is there.
Right.
It'll be also interesting from an IGA point of view
It
to
will.
see whether some of this awareness can extend. But once again, when you overall extend, my awareness as a doctor, even in practice, because we had some patients that were transplant patients, kidney transplant patients, and we'd see the tricumulus levels come through, and we were kind of hands off because that's the specialist gig. Um, but after we went through the process, then we were a little bit more of like, ooh, you might want to have that value looked at. You want to pay,
Yeah.
you know,
Right.
and it's all that level of comfort and awareness.
Mhm.
Certainly if I'm co-managing a patient with the cardiologist,
Yeah. Of
if I
course.
see anything sideways, I'm going to jump all over it. And,
Yeah.
and and the cardiologist is like this with me, being like, yeah, we're working together. We're working together.
Mhm.
So it's
Right.
not necessarily like you're overstepping boundaries or something. Everybody's trying to help.
Sure.
But I think there's still a big lack of awareness, with kidney disease, and particularly IgA nephropathy.
Exactly. So, okay, Dr. Warner, thank you for that. And we went off on tangent, and I'm okay with that. Next question, um, living donation, and just kind of, we talked a little bit about this earlier before we recorded about it kind of slowing down. Like, I mean, I think I've seen numbers. I mean, we see we had 100, we have, can't remember my figures off the top of my head, but I mean, when in the state of Kentucky, for example, to get a deceased donor kidney is 5 to 10 years. I'm not sure what it is in California, but I mean, if we can obviously advance and promote living donation, i.e., this recording and what we're talking about with living donors and things, that can obviously, in essence, make the list shorter. But it feels like that I've seen in the last 5 to 10 years that promotion and awareness of living donation I've seen in my state, it seems to be slowing down, and it's kind of like sort of like peaking in the downward trend and not in the upward trend. Could you speak to that a little, the way that you may have seen or not seen out in California about just the promotion of living donation and to that? I'd love to hear what you have to say about that as well.
Sure. Well, I, it's funny. It's interesting how society can swing and change,
Yeah,
and how that can swing and change even over so many years. I mean, to the point where, if we were to go back in the 50s, for example,
sure.
and I were to say, hey, I want to be a doctor. If I was a male or a female, I would probably be treated differently by lots of people in the process. It,
Hmm.
it could it could be my family, it could be my friends, it could be admissions boards, it could be everything,
Sure.
and there could be that gender gap.
Right.
And we see that today on how we've made such great progress on gender,
Yeah.
race,
Hmm.
um, you know, all sorts of things across the board.
Right.
And it doesn't mean that we've solved it for sure,
Of
but
course.
but but it's nice to see that. It's nice to see a movement
Sure.
to where all of us can feel comfortable in society, as an ultimate goal.
Hmm.
um I think that awareness in what you're doing right now is super,
Hmm.
in showing what can really be like for someone, to be in trouble with the kidney disease, especially as a child,
Right.
and then to be able to receive an organ from another person, and then to be able to to live a relatively normal life. I mean, if you don't mind us flipping, you
Yeah.
know, give me the difference, because some people say, well, you can just go on dialysis. But if I were to ask you, what's the difference between your normal life, back when your kidneys were fully functioning and you had
Right.
no
Right.
idea anything was going on,
Hmm.
your life on dialysis,
Yeah.
and then your life with
Transplant.
a transplanted organ in you?
Oh
Uh,
yeah.
those three, what do those three look like?
Oh my God, yeah. So I mean, honestly, when you're in your early 20s and you have your life in front of you, I was invincible. Didn't think anything of it. Was thought I had the flu, and blood work comes back, and find out my kidney's failing, and it's not the flu. Um, then dialysis for the 2 years I did dialysis. That kind of just shook me and put me into a position of just like, okay, I'm not invincible. I'm in my mid 20s. I'm trying to kind of figure out what's the next step. How do I get a kidney? Who do I ask? How do I have that conversation? I reached out to all. I was new to the arena of kidney disease and understanding the folks and the people, the nephrologists and the dialysis centers, um and so that was really scary in that period of time. And then once I got the kidney, and I've had it now 13 years, I realized, for me, and maybe it's just kind of my environment and how I was brought up, learning to kind of be my best advocate, and to kind of learn, okay, like, I went through this. It doesn't define me. I'm gonna continue to give back, and I'm doing pretty well, and I do these things like I'm doing today, to promote and to kind of give advocacy and education to folks who are going to be listening to this for the first time and want to know what living donation is all about, and kind of help bust those myths and go from there. Yeah,
So right to the point, though, is that you tell me the difference on how you felt when you were on dialysis to how you feel, particularly now,
sure.
with the, how you feel with the
Transplant.
transplanted organ working in your body.
Yeah, yeah. So I mean, at dialysis, it was a scary, scary time. Didn't know if I was going to live or die or live. It was, n- young, and kind of was like, okay, what's in front of me? Like, am I going to die? Is it going to affect the rest of my life? Am I going to have kids? I mean, all questions. My mental health was definitely not at my strongest at that point. It was pretty, pretty bad. And then, as I kind of learned to kind of dig out and see the light, and kind of continue to get the education and kind of talk to people, and here I am now 13 years later, able to kind of show people, hey, this is that's not a death sentence. Dialysis isn't a death sentence, even though in the moment and the time I felt it. I was able to come out of this 13 years later, and been able to, be able to be, show that you can come out of it as a young person. I was in my 20s when it happened, and I'm 40 now. So, I've been able to kind of, to answer your question, yeah, I've been able to compare that it was horrible, and my mental health was at its worst during dialysis and during the early stages of my disease. And now I'm able to manage it with education, awareness, having conversation with folks, obviously taking my medicines and going from there. Yeah.
So if a person said to you, well, donations, living donations aren't really that important because there's always dialysis. What's your
Hmm.
response to that?
Oh yeah, I would say, something, dialysis is there for a reason, and I don't. I think that, what have I told patients? I've told patients a lot of different things, honestly. You know, I would say to a patient, it's like, hey, there's always dialysis. I don't want to give a kidney. I said, understand that a person who's on dialysis is living, but isn't living their best life. They're not able to travel as easily. They're not able to, they might have other health issues that kind of come out of dialysis, either issues with their bones or issues with their heart if they do it long term. So to give that patient, that person, more education about, oh, it's dialysis, but there's more to dialysis than just, yes, you're alive, but are you having the best quality of life? Probably not. I mean, safe bet to say, I'll say it from my opinion as a layperson, as a patient, you're not going to have your best life while on dialysis. Yes, it's there, but a living donation would give that person a better quality of life at the end.
Right. I mean, not to put down the
Yeah.
the life-saving benefits of dialysis and
Right.
all the people that do that work,
Yeah.
from the providers to the technicians to all the
Hmm.
valuable people there.
Right.
What we're talking about is that how kidney transplant can can have a superior
Yeah.
experience for the individual person, to the point where they can very closely resume uh, what the rest of us might consider to be normal life.
Exactly. 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 Yeah. Most definitely. Most definitely. Gotcha.
Yeah, we had talked a little bit before about what surprised you most, and I think what surprises me most is, yeah, this lack of awareness, and even to the point of what benefits it gives to people like you,
Hmm.
to my son,
Sure.
you know, to you know I mean, I'm missing one kidney. I guess I weigh a pound and a half less or something,
Right.
So,
Yeah. Yeah. Yeah.
and I don't mean to be that trivial, because you have to get better, and
Yep.
I have to be careful in a sense. I mean, if I'm sore, maybe before I would have popped an Advil and been like, yeah, I'm taking Advil. Well,
Yeah.
now
Yeah.
now now
Right.
now
Yeah.
now I'm just like, nah, I don't need to do any of that,
Exactly.
and and
Exactly.
and and, and because I know there's going to be a day near the end of my life
Yeah.
that I'll be able to look back and say, oh, it's a good thing I didn't take those Advils, because
Exactly.
I
Right.
want every bit of my kidney function
Yeah. Right.
as possible.
Hmm.
So, and it also means that if I were to take different medications and stuff,
Yeah.
or, even if I got really sick and had to be hospitalized, there might be certain medications or drugs or antibiotics, for example, that they might say, well, maybe we don't want to do that one because it's so heavy through the kidney that we'll
Hmm.
use a different one. All right,
Yeah.
but that's
That's
just choices.
exactly. Exactly.
And
Exactly.
for me, what a father would do for his son, to me, that's all really trivial. Um,
Hmm.
I think some of the stuff that you're talking about is, it gets down to, um, somebody who's thinking about, um, do I want to donate,
Right.
probably comes in two forms. One is, first of all, if something happens to you. I mean,
Obvious.
holy
Right.
cow, we're in our cars all the time, and there could be car accidents. There could be all sorts of things that could happen,
Right.
and and I'd want myself, for sure, to be in a situation where, if I was brought to the hospital, and I'm there's no way to really save me. Oh, for Pete's sake, my donor card, take whatever you want.
Yeah. Yeah.
And there's
Yeah.
a lot of myths out there that if you go to the emergency room and you have a donor card, that they'll be like, oh, good, let's
We'll
let this
harvest their
person
organs.
die so we can get the organs and stuff.
Yeah. Yeah.
And
No.
and, and I can tell you, watch the news right now during this COVID crisis,
Exactly.
and look at those people and say, are these the people that are thinking that way? And the
Exactly.
answer is, no, they're
No.
not.
Yeah.
They're trying to
Exactly.
help everybody.
Right. Right.
They're trying
Yeah.
to help
Yeah.
everybody. They're not there with like nefarious thoughts in their head, like, oh, what am I doing here?
Mm-hmm.
They're and even right now, they're just trying to get through their shift and help people.
Mm-hmm. Mm-hmm.
They're,
Hmm.
they're just, they're
Yeah.
just trying to help people. I mean, how blessed is that? So it's the same way. And there might be situations where, someone could get in an accident, and by the time they got to emergency room, they can't
Yeah.
harvest anything for
Right.
different reasons.
Exactly.
Okay,
Right.
okay,
Yeah.
but there's going to be lots of cases where they might be able to take they might be able to
Something.
take they might
Yeah.
be able to take the organs.
Exactly.
And to think that you could pass on, and I mean, I know for myself that I can pass on and know that I was able to give a kidney to my son.
Yeah.
Okay, that how nice, right? But
Right.
but how really cool to 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 pass on, and be able to leave a legacy of where you were to help multiple people. And we've seen stuff where people will talk about the heart they got, or the cornea they got, or
Hmm.
so they can see, and all that sorts of things, and certainly from a kidney point of view. Now the real trick gets to about living donation,
Yeah.
and wow, I mean, that certainly puts pressure on family members, you know if they're going to feel obligated. I mean, for me, it's my
Yeah.
son, I'm just going to do it. That's just
Yeah. Right.
just like wired that way, whatever.
Yeah.
But I can understand on how it starts pushing. I mean, it was just an absolute blessing for us that when we got through the problem, we had people reaching out,
That's good.
family and friends, can we help, and think of
Yeah.
us, and whatever else.
Hmm.
And I think part of that gets back to society. I mean, if I were to go out for a walk right now, take our little dog out for a walk,
Yeah.
and go out for a walk, when I'm walking down the street and another person on the sidewalk approaches, I walk off to one side because social distancing. They walk onto another. I can say, "Hey, how you doing?" And we keep walking. But it's all cool. I mean, it's
Yeah.
all it's
Yeah.
all cool. Everybody's cool about that. It's not like one
Hmm.
person's being rude or whatever.
No.
Because society, we're realizing that this is something that's important.
Exactly.
And that's what gets back to your campaign that you're promoting with
Yeah.
this series,
Hmm.
and IGAN's promoting, is that kind of awareness that it can be done. I mean, for me, I've got one less kidney and a little scar, and you have to recover, and you get back to work, and you worry, but my worry about myself was minuscule compared
Right.
to the worry that I had for my son.
Of
So
course. Of course.
it's
Yeah.
yeah, I think probably one of the best solutions, one of the parts of the puzzle is, you know messages that you're delivering right now, and hopefully people will engage and
Yeah.
that'll make them think about it and have conversations with their family.
Exactly. Dr. Warner, you've that's spot on. I mean, yeah, that's really what what I strive to do in my daily work, and what this video series is going to be doing is continually having that dialogue, having the resources for them so that they can kind of, if they're, if they get newly diagnosed with IGA and they're just like, hey, I want to know about with kidney disease and living donation, what's going to happen for my child in the next 5 to 10 years, or that they have this resource. And if I can continue to do that and have these kind of dialogue, I'll continue to do that. And yeah, I appreciate you giving me your attention, and you've brought me some good insight to help our audience. I really appreciate it very much.
Well, a couple other issues.
Yeah,
um
let's chat.
we briefly talked about this because you're how many years now?
13 years.
13
Yeah.
years with your kidney. Yeah, we're about to hit our 8th year
Right on.
anniversary,
Cool.
coming up, actually within this month.
Oh, great.
So 8 years. And right now, we were kind of talking a little bit earlier before we started this, that how long were you told the average kidney last?
Hmm.
When we did ours, in Pittsburgh, uh, 2012, we were told on average 11 years. You were told up to 15,
Right.
kind of stuff. But we know of people that have kidneys that they're 25 plus years.
Exactly.
You know?
Yeah.
And I think it's going to be, as the awareness improves, and and as people advocate for themselves, and are able to tell their stories when they see the provider, and that information can then be data mined.
Definitely.
I don't, you probably don't know it, but the documentation guidelines are all changing, particularly in the outpatient office scenario, next January 1st, 2021, where the whole history of the story is not part of the physician pay anymore. It's now the patient's ability to send information in. And this is all stuff that was that was done by the government way back in 2018 because they knew there were better ways
Mm-hmm.
to free the provider from clerical burden and to empower patients to be able to participate. But
Yeah.
get a load of this.
Sure.
Like for my son, for example, he takes tacrolimus
Yep.
as an anti-rejection drug, like a
I
lot
do
of
too.
people,
Yep.
probably a lot of people that would listen to this probably do.
Yeah.
And he's suffered with horrible migraines. I mean, he's migraines, and he found by going gluten-free that he could reduce those migraines very, very low, even to the point where if he eats something that was gluten-free but was cooked in a pan that was good, he can still pick up on a little bit and it'll trigger.
Interesting.
So, is that anecdotal? Is that, out of a million people that he's only the one and it won't make any difference for anyone else?
Sure.
That might be the case.
Hey,
That
but it
might
worked
be.
for him.
So, for me to say that and say, oh yeah, for him it helped, it might just for him it helped and no other human on the planet helped. But you and I know that there's
Yeah.
probably lots of patterns there.
Yeah.
Probably lots of patterns. And maybe it'll be people that only have certain color hair that do, there might be something silly.
Mm-hmm.
But it'll be really interesting to see the awareness come up, not only for the general population, but also for the provider population,
Yeah.
to realize that this information coming in from the patients actually might. I mean, look at COVID right now, where some of the early anecdotal stuff
Mm-hmm.
is tending to show that ventilators might not be the ultimate answer.
Right.
That it's out of 10 people on the ventilator, it looks like 2 are surviving and the other 8 are still having trouble.
Mm-hmm.
They're finding stuff out now with COVID that it looks like it binds with certain receptors, and that it might be disrupting the hemoglobin molecule and releasing the iron and causing inflammation process, and also not allowing the oxygen to bind.
Mm-hmm.
So that's why some of the potentially anti-malarial drugs or a bunch of old medications that are out there might actually have an effect.
Yeah.
um, People like the president have jumped on this early, and it may actually pan out that some of this is true.
Yeah.
But once again, we have to be really careful about jumping onto
Too
a
much.
quick conclusion without the evidence.
Yeah.
But with transplants, we've kind of been around like
Around.
16,000 a year or something
Yeah,
like
we've
that
been around a little. Yeah.
for a
Yeah.
bunch of years. There's data there. There's data there,
Mm-hmm. Right.
and it would be really cool for if someone like you, if I could ask someone like you, like, how do you feel? And you could tell me, I'm feeling pretty good,
Mm-hmm.
and say, well, what are you doing?
Yeah.
And
Right.
then be able to overlap that with somebody that says, I'm not feeling that good. Well, is there something that you could do that could help that line? That's what's going to be really cool for your population.
Yeah. I'm excited to see that come down the pike and see the changes and how the trends what the patterns will look like as we look at that data moving forward with that new. You said that's starting in January of next year, correct?
Yeah,
For outpatient.
21.
Yeah. So it should be good. I'm excited.
Yeah. But back to the main thing of this.
Yeah. Yeah.
Um, yeah. No second thoughts.
Okay.
I'm 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 happy to see the result in my child, and also happy to see the results in everyone that's been down this pathway, such as you.
Sure. Thank you. Yeah.
I mean, it's really beautiful. What a great blessing to the world that we could be a society where somebody could have a problem, and we could take an an extra organ out of someone,
Right.
put it in the other person, and they could go on and live their life. And whether it's a blood donation,
Right.
whether
Yeah.
it's an organ donation,
Mm-hmm.
a lot of it comes down to being able to give life, and for people like you to receive life where your quality of life can be increasingly close to what it could be for normal, so that you can live your
Exactly.
life and you can participate in society.
Yep. Yeah.
It's really a beautiful thing.
Yeah, I've been fortunate in my situation to, like, when I got diagnosed, I was young I had moved to Kentucky. I'm from Connecticut originally. I grew up in the Northeast, have lived in different places, but when I moved to Kentucky with my fiance at the time, we dealt with just me being new to Kentucky, new to her relation, was with her and knew only her, didn't have any family. And to be able to like as I look back at it now, like 13 years, 14 years from the diagnosis and the transplant and stuff, I think about how um how blessed I am to have a second chance, have a second chance at life and to be able to kind of give back. That's my biggest thing. Like I don't like, yes, I feel fine. I feel good. I've had my acute moments where, I just want to be normal. And I've had moments where I've missed medication and I feel bad. I'm like, oh, why'd I miss that medication? But life happens and you make mistakes. We're human, right? I'm not a robot. I'm going to forget sometimes. And so I had to pay for some of those consequences and been able to learn from that. And so now 13 years later, I continue to just, want to impart any wisdom I can as a patient who's gone through this, and can kind of share my insight, like you kind of said before, about kind of talking to somebody who might be in the similar situation that I was in, and be able to kind of just give any word of wisdom, piece of advice as a layman person, not anybody who's clinical, nothing against doctors or social workers, but I've lived it as a patient, and to be able to continue to um, just help folks have the best quality of life that they can, whatever that looks like for them. I'm not, if it's changing their diet by, lowering their sodium, or, finding alternatives from something that is maybe high in phosphorus, or, whatever the case may be with their kidney, whatever their struggle is, if I can help give them one piece of advice or one piece of wisdom, I've done my job, and I'm okay with it if it's only one person. That's kind of where I come from. That's kind of my mindset. And yeah, it's been living donation is, like I said, my living donor and I have a relationship. I met her through a church I attended, and we still keep in touch. And we talk on the anniversary, and I've connected her actually here in Kentucky and helping me be a peer mentor for living donors. So she's as a recipient, I work for the University of Kentucky's transplant program, and I talk to patients. And then what she's doing on her end is we've promoted and we've kind of worked on doing a peer mentoring program for living donors, so that if a recipient comes to come into the office and said, hey, I have a family member who wants to donate, we would ask the patient if that we would ask that patient if their prospective living donor wanted to have a conversation with somebody about what that process is like. And so we just rolled it out right before COVID. So now it's kind of on pause, but hopefully in the fall and in the winter, we'll start to see some data if that will really help the natural, like, one-on-one relationship between somebody who's done it and a living donor like yourself and patients who are in our region, having that conversation and say, yeah, I'm going to really take this seriously because I talked to Joanne and she said this is what I could expect to do. And then that'll hopefully continue to kind of build and build and build, where it'll be that hopefully those myths will kind of be completely debunked, like the whole issue we talked about with, you get into an accident and you think you're afraid you're going to lose an organ in the accident, and they want to just harvest your organ. Well, no, that's not the case. They're gonna do no harm. They're gonna kind of get you to make sure that you survive. And if you can't, then they have that conversation, and that's where other organizations, OPOs, and things like that come into play. But for the most part, if we can just start that dialogue, by having a recipient like myself talk to patients who are going to go through a possible kidney transplant, and a living donor to talk to another living donor, prospect, it would be that's the hope, and that's the continuation for the series, and continue to do it for a while. So that's what we're doing.
I like that. And I think in light of COVID,
Yeah.
something that you marked about it is that so much of the attention right now. I mean, every station you turn on,
Yeah.
the
You can't.
every. Yeah, you almost have to watch a movie or something just not to hear about it until the commercial comes on, then you hear about it again.
Yeah.
So, it's you have to go on
Something.
just
Some
a
kind of
movie.
hiatus.
But so there's probably a lot of people right now that might be struggling with some degree of renal failure.
Yeah.
They might be really early in the process where, who knows where it's going to go. Maybe they'll go the rest of their life and everything will be fine. It'll just be a lot of monitoring.
Right.
Or maybe like in the situation with my family,
Sure.
and unfortunate with you, maybe it'll
Get to that
have to
point.
involve further intervention.
Mm-hmm.
For this particular moment in time, it can appear that the focus is on COVID, for example, and not on your problem. You
Right.
know, and I think that because of the alarm right now, and right now as we're recording this, I mean, we're just supposed to hit the peak in
Hmm.
multiple big cities.
Right.
We're right at the crest of it. uh Certainly that's going to be the headline news, but it there will be a time where this settles down,
Yep.
and certainly social distancing and attention and praise to healthcare workers, frontline people, supporting them, and all this. It's going to run its course. I think afterwards it's going to create a different kind of awareness of healthcare and what healthcare means.
Agree.
And there's a chance, some of the speculations are coming out that perhaps COVID will what if COVID, rather than claiming 200,000 American lives, only claims
80.
80,000
I've heard that.
American lives. Well, once you get into that 80 range, you're within the bandwidth of what the flu does every year in this country, which
Yep.
can kind of go from 35 to almost 70 kind of stuff.
Yeah.
You're real close to that range.
Right.
Um, but but even if we're able to hold that back, we know that if we would have let this out, it would have just. I mean, there are emergency rooms that are right now, as we're talking, overburdened, and they don't have enough supplies, they don't have enough people, they don't have enough staff.
Yeah.
It's like a small town that has a great fire station, and if there's two fires going on, they can handle the two fires. But if there's 10 fires going on, they're going to need help from other people.
Yep.
But if every other little community has 10 fires at the same time, well, then you're going to have whole blocks that burn down
Hmm.
because you can't
Right.
give
Can't pay
attention.
attention.
So
Right.
by us holding it down, we're able to help. But I think that after we get past this,
Hmm.
that I think there's going to be more empathy to healthcare in general, and that what do we really want, and what do we want to set up. I don't necessarily mean that the answer means that we have to have 5 billion ventilators ready to go at any moment,
Right.
but it can be more along the lines, specifically with our conversation here, of what with kidney failure. What options do we have? What options do the people have? What options do they have for coverage? Is the coverage good enough? Is the coverage good enough that you can get your transplant? And because the price of dialysis is very high, and when
Sure.
you add up the price of transplant over the years,
Yeah.
it's actually a huge cost saver. It's way cheaper
Yeah.
to do the transplant and have you go decades and
It's like
decades
it's eighty
by.
thousand dollars a month or something like that for a dialysis patient. I think it's crazy. It's
Right,
outrageous.
right,
Yeah.
right. So it's a savings to society,
Yeah.
and any deviation off of that savings costs us dearly.
Hmm.
So it may be worth doing stuff where we'd be able to advocate that once renal failure, once transplant, that perhaps you're covered by Medicare forever.
Yeah.
And at least that prevents the gaps and prevents the fall off.
Exactly.
And among the circles, you and I have heard of different people that have
Yep.
lost their insurance and they
Right.
can't get their pills. And what do? These pills, by the way, aren't pills that are you know thousands of dollars a month.
No. Right.
But the idea is, if you don't have the money to pay for it,
Yeah.
even a $30 prescription could get lapsed.
Yep.
And the next thing you
Agreed.
know, the person's back in the system. We're back paying full price, and we're looking for a kidney, and we're doing dialysis.
Bad
And
cycle. Yeah. It's a bad cycle.
so,
Try to
so
break
it's
that cycle.
it's a
Yeah.
bad cycle. But I
Hmm.
think that so I think for people out there that might see all this happening with COVID and saying, hey, the focus is off target of helping all of us with our different problems, whether it's
Hmm.
heart disease, kidney disease, or
Right.
whatever else.
Yeah.
I think the redeeming part of this afterwards is going to be some really good conversations that occur at all levels into what do we really want and what can we do. And if we're able to come in with trillions and trillions of dollars after we're hit,
Yeah.
wouldn't it be better to spend millions of dollars to prevent going forward?
Right.
And if we can target areas of problems, for sure, renal disease is one of those.
Oh, heck yeah.
So what would it be if we had urine test,
Hmm. Early.
for
Yeah.
children to see whether there's blood in their urine?
Exactly.
What would it be to have conversations about organ donation should you pass away,
Mhm.
or organ donations while you're alive, and how that can be
Correct.
mitigated. And if you're looking for proof, well, look at your picture right now. Look at you.
Yeah, yeah, exactly, exactly. It's
Look at
true.
you.
Very true.
And look at the smile on your face. I mean,
Yeah,
that is a
right.
genuine smile on your face of someone who has benefited from the goodness of humanity, from the minds of the
Yeah,
researchers, scientists, and all that allowed this to happen, and also the absolute blessing that your donor gave to you.
you're right,
Now, for me as a donor,
right.
that's my own personal business. I'm giving it to my son. That's fine.
Sure.
But holy cow, I can't.
Yeah,
But your donor,
yeah.
coming to you and helping you,
Mhm.
that is just, you know, I can't think of anything greater that one human being could potentially do for another human being. I mean, what an act of kindness.
Yeah, it's a blessing, and I mean, it's something that she and I have done talks and had conversations in groups in and around Kentucky, and it's been wonderful. And it's been, and we there's so many folks who are similar in my situation who I've talked to other living donors and recipients and recipients, and it's been what you've been kind of saying this whole time. I'm hearing the same thing back. So it's there's for me as a recipient, like it's a no-brainer to be like to continue to give back, to continue to do what I'm doing, to get her connected as well, to get other people connected, have series like this. But I wonder, like, why, like you mentioned earlier about how society as a whole needs to be flipped, like kind of like flipped on its side. The paradigm needs to change a little bit. And I think what COVID's doing, like you just said, I think COVID is gonna really open our eyes and kind of look at healthcare, look at organ donation, look at, I mean, even before all this happened last July with advancing the American Kidney Act that Trump signed into
Right,
place. And so
right.
some of those things, I mean, that's another conversation. I mean, there's things that are coming down the pike. And I would just want to continue to be a voice at the table, like in doing things like this, and we'll continue to do these things, just because it's my passion. It's what I feel anybody who has empathy and with a good heart or organ, would be willing to have that conversation and 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 do that and kind of get our list, because our wait list is so long. And I mean, it's like, why? I mean, there's so many opportunities for, I mean, not only living donation. I mean, I can go into, I mean, there's realms of, I mean, we've talked about like 3D printing and looking at organ and people creating that kind of stuff. There's been conversation about using what we call xenotransplantation, where you use like, there's been conversation with using pig organs, like pig kidneys for humans. And there's been, studies and kind of conversations about how that can happen. I mean, as a whole, there's a lot
Right,
of
right.
moving.
Well, even on the science side,
Yeah,
I'm
right.
sure you've been asked many times, did they remove your old kidneys?
No, and they don't. Right. Exactly. They
Yeah,
keep it in.
yeah,
Yeah. Right.
yeah. They leave them in there, and
Yeah.
and and that's kind of interesting because, from a Star Trek point of view or whatever,
Yeah.
there will be a day. I mean, there will be a day. I don't
Yeah.
know. Will it be
Yeah.
50 years or 100 years or 200 years? There will be a day where either by a nasal spray
Hmm.
or by a long needle into your kidney that's in you,
Yeah.
that you're going to be able to inject,
Some kind
whether
of.
it's stem cell material or whether
Right.
it's DNA, RNA. I mean, look, this whole COVID thing
Yeah.
is because a virus can land on your cell
Uh-huh.
and then penetrate in and put in a bunch of RNA.
And just start replicating. Right.
Just like a computer virus, it
Yeah.
gets in there and it starts generating, and it makes more of itself, and it overtakes the cells, and it takes command
Hmm.
exactly like a computer virus. That's why
Yeah.
we call it a computer virus.
Exactly.
But
Yeah.
but but just like that. But there's also ways that stuff like that could actually deliver
And help.
genetic information, and whether it's through that or whether it's through stem cells. I mean, imagine being able to take you and do something to the point where, I mean, you once started out as one cell,
Right. Of course.
as
Yeah.
an
Yeah. Yeah.
egg and a sperm. You once started out that way, and your
Yeah.
body knew what to do. That blueprint's in there.
Yeah.
And so there are certainly ways scientifically that we haven't discovered yet
Yeah.
that you're going to be able to get in there and boom, and those kidneys are going to go, and they're
Yep.
going to grow back, and
Yeah.
they're going to be absolutely fine. How
Yeah.
wild.
And
I mean,
it'll be
the
wild. Yeah.
architecture's there and stuff. So, but that's the dream. Now
Yes.
the reality right today
Yeah.
is you living the way you are,
Yeah.
you being supported, and especially for any audience out there that would watch this conversation and the conversations that you're creating,
Mm-hmm.
is to feel like this is a place where you can come.
Yeah.
You can feel like you're part of the discussion. You can feel like you're part of this family, so to speak,
Exactly. Exactly.
and not to feel alone, and to know that there's support out there.
Definitely.
And so I
Definitely.
commend what you're doing, Alex.
Thank
It's really
you, Dr. Warner. I appreciate that very much. Thank you. Thank you. And I appreciate, I've shared this with my other previous living donors, but thank you so much for giving your son a second chance and giving him that opportunity to live his best life. I mean, and what you're doing is phenomenal. And being in medicine, obviously having that nuance and that clinical side of it, it makes even probably, maybe ignorance is bliss sometimes. I don't know. I can't speak because I'm not a doctor, but like, knowing some of the things as a medical doctor, and knowing, like, as a patient, as a parent, having both those sides. I mean, it's amazing that you have that knowledge, and to be able to kind of utilize it and help your son is wonderful. So I really appreciate you and commend you as well. Thank you for doing what you do.
Thank you, Alex. Thank
All right. Well, we're gonna take off here. I appreciate it very much. And if anybody has any questions, feel free to reach out to either of us after you watch the series, and we'll go from there. Have a wonderful day, everybody, and thanks again. Bye, everybody.
Bye, everybody.